keynote for this morning. When we chose the theme for this year's conference, we chose impact, because we do lots of research, but we need to think about what difference it does make. So we chose Professor Hugh McKenna to come along and share his insights into the impact agenda, both as it's playing out in a research exercise, but also more generally. Many of you will know Hugh McKenna. He's a professor and dean at Ulster University. He has over 250 publications, including 16 books, and has raised over £4 million in research grants. Successfully supervised 18 PhD students, and his work has been highly cited on all metrics. He's a visiting professor in a number of countries, including Australia and Hong Kong. And from our perspective in 2017, importantly, he was appointed chair for Sub-Panel 3 for the UK Research Excellence Framework in 2021. So just round the corner now, this next assessment. Hugh also chairs the Swedish Research Council's Clinical Research Review, and he's been identified as one of the 70 most influential nurses since the founding of the NHS. There's more, but I think I will leave Hugh to tell us about his topic, and we are really pleased that he was able to join us to open this year's International Nursing Research Conference. You're very welcome, Hugh.
Thank you, Danny. After that introduction, I can't wait to hear myself speak. In 1986, 33 years ago, the UK started its first research assessment exercise. Since then, it's had many iterations, and it's moved from being a research assessment exercise to research excellence framework. Also in 1986, I attended my first RCN research conference in Nottingham. And there are some people here today, and I think Anne-Marie may be one of them, that I've seen back then, and I look forward over the next 3 days to meet a lot of dear friends that I haven't seen some time. It reminds me of something I said at a recent Council of Deans conference, that there are 3 ages to humankind: youth, middle age, and gee, you're looking good. I'd like to thank the organisers for asking me to do this presentation. This is the topic they wanted me to speak about. Since it's a little UK-centric, I'd like to apologise for those colleagues from outside the UK who are with us here today. However, many countries across the world are doing their own version of the REF. The last count, it was about 36 that are doing some sort of research assessment exercise. And they do this exercise so that they can have some sort of metrics to allocate public taxpayers' money, public funding for research. Several of those are also looking at including research impact, Sweden and Australia being the obvious examples. But I also suspect that most people in this room today are interested in how our research has impact. Here's what I propose to go through over the next 30 minutes or so. And you can see that at the end of it, I've analysed 248 cases, impact case studies that pertain to nursing, and I'd like to share that with you. But along the way, I'm going to deal with what is impact and why should we measure impact, and how can you make your research more impactful. Here's an overview of the REF 2021 process and structure. I'm not going to go through it in detail, but you can, and by the way, these slides are available for you if you want them. All you have to do, I think, Danny, is contact either me or the organisers, and I'd be delighted to share them with you. But I'd like to concentrate on just a couple of issues on this slide. There are 4 main panels. The one that you should be interested in is main panel A, which is the one that nursing sits within. Under these 4 main panels, there are 34 sub-panels. And we have been allocating and nominating people onto those sub-panels now for a couple of years. and I'll be revisiting that in early 2020 to appoint some further assessors onto the nursing subpanel. You can see here under main panel A, there are 6 subpanels, and the one that I chair is subpanel 3, nursing, midwifery, allied health professions, biomedical science, pharmacy and dentistry. It has been identified as one of the most diverse panels in the entire REF process, and I think you would agree. And Anne-Marie has been on the REF panel before, and she would agree that it's quite an interesting but quite a complex undertaking. There are 3 elements that are assessed within REF: outputs and publications, if you like, research environment, and the one that I want to focus on is research impact. Actually, I'm going to be talking about outputs and research environment at 1 o'clock in a different room in this building, but for the moment, under research impact has increased considerably in terms of value within REF. Back in 2014, the UK Treasury wanted it to be worth 50%, but after a lot of complaint and consultation, it was 20%. That has now gone up in 2021, and in real terms, there has been an increase of 56%, and that, I think you would agree, is highly significant. UK research universities have to return all staff who, and I quote, have significant responsibility for research. In some departments, that will be 100% of staff, in other departments, less so. In 2014, across the entire REF exercise, we've seen almost 7,000 impact case studies, and I'll be returning to this theme later on. But we want to ensure in 2021 that we don't see any more than that. So we have looked at the number of case studies that are submitted per members of staff. Back in 2014, it was 14.99 for every 2 case studies. This has now been changed to 19.99 for every 2 case studies, and so on. Here is the content of an impact case study. You can see it's made up of 5 different sections. It's over 4 pages, and they're delightful to read. We enjoy reading impact case studies and assessing them. Our day job means that we're always assessing or reviewing manuscripts for publications. So that's after we do about 200 or 300 outputs in terms of assessing them, to come to 4 pages of impact case studies, and they're fascinating. So we do look forward to seeing really good impact case studies. Okay, why should we assess research impact? Well, traditionally, across the world, university research excellence has been judged by outputs, publications, citations, and impact factors relating to those. In fact, many people said that research is not finished until it's communicated. To some extent, that's old hat, and you can say now that research is not finished until it has some benefit or makes some change. We grow no food on campus, so like every priest, potter, and poet since the dawn of civilization, we have to have some faith in the usefulness of what we do provide. Universities have traditionally been seen as reservoirs of knowledge, but increasingly society is demanding that they become bridges between the world of knowledge and the world of impact. Now, this is not new. In ancient Greece, the Agora, which was the business institute, was located alongside the academy on the slopes of the Acropolis. And this was to ensure that business people, merchants, had every opportunity to meet scholars and academics, share their problems and share their solutions. Today, more than ever, we have to encourage the seamless transfer of ideas and knowledge from the research labs to the lecture hall, to the marketplace, to society, because we know that research encourages innovation. Innovation fuels productivity, and productivity fuels the creation of wealth and social change. Sir Ron Deering, who wrote a famous report on higher education, said that the centres of the community in the Middle Ages was the medieval castle. In the 18th century, it was the mines and manufacturing industries. Today, it is the university. I would argue that not only is the university today being the centre of the community, but it's also at the very heart of innovation and at the very, very heart of impact. There is a moral imperative on us, on everybody in this room, to ensure that their research has impact. You can't really give a keynote at a RCN research conference without mentioning Florence Nightingale. Nightingale said in 1859, and I quote, "We must show people how their money is being spent and what amount of good is really being done with it." Each year, £2 million is allocated to universities, taxpayers' money, to fund research in universities. £2 billion. That's a lot of money, and we have to see what good is made of that money, hence the impact agenda. And to paraphrase John F. Kennedy, ask not what society is doing for your research, ask what your research is doing for society. Now, 250 years before Nightingale, Francis Bacon famously said that the purpose of research is to be of great benefit to mankind. Impact. And Nicholas Stern, who reviewed the REF process after 2014, identified 5 justifications for REF. You can see one of them here is to provide accountability for public investment and produce evidence and the benefits. And finally, in this slide, since 2014, a lot of researchers have investigated data from the REF process, including Danny and Anne McMahon and colleagues and others. One finding that has come out from some of the research is that UK research has had impact in 195 countries. Why is that important? Well, it's important because that's all of the countries in the world. And you can see that the Treasury and the government are very proud of that, and that means that they will hopefully increase the amount of funding going for public research into UK universities. There's been some changes since 2014, and you can see on this slide some of the changes in terms of definitions and guidelines, but also some of the refinements. I just want to deal with 3 of them. Under guidelines, back in 2014, you could put forward impact case studies for education, teaching, pedagogic research, but it had to take place outside your university. It could not be inside your own university. That has now changed. Although I know somebody very senior in the government who says that they have a bottle of very fine Scottish malt whisky for the first person who can come up with an impact case study that is 4-star for research inside a university department. I hope to see several of those in sub-panel 3. Also, every piece of impact has to have some sort of underpinning research. That's going to remain equivalent of 2-star, which means internationally recognized research, but we're going further than just outputs, publications, to be able to reflect that 2-star. We're going to look at bodies of research. So that also has changed, and I think that has been very welcome. So what is research impact? When I think of research impact, I think of benefit. But here is a definition for you. It's about benefit, it's about change, it's about effect. And on the 3 Ps, processes, in other words, in terms of activities, in terms of performance, in terms of opportunities, people, individuals, groups, audiences, communities, or places, local, regional, national, and international. When you judge publications' outputs within REF, you use significance, originality, and rigour. When you judge the research environment, you use sustainability and vitality. When we judge research impact, we look at reach and significance. You can see the definition for reach and significance here. If you take this presentation that I'm given this morning, this keynote, let's look at the reach for that. The reach could be every individual who attends the RCN Research Conference in Sheffield in September 2019. That would be my reach. I don't know how many people are down in the bar or how many people are on their phones outside, but that would be the reach. And I've got quite a good reach here with the number of people in the auditorium. The significance would be the effect, the intensity of that in terms of how you change your understanding, how you change your behaviour, how you change your knowledge, and perhaps attitudes as a result of this presentation. So in terms of public engagement, that's how one would measure reach and significance. You can see also that we do not judge reach and significance separately. They're dealt with in the round. And that's again, something I'll come back to later on. Here is a slide that's probably next to useless, but it's used by most people who are responsible for managing REF. I suppose the only thing I could point to this slide is that there are actually five categories from unclassified to 4-star. And unlike outputs and environment, which the terminology to judge them is internationally excellent, world-leading, internationally recognized, etc., when you're talking about impact, it's outstanding, very considerable, and so on. How did panel members assess research impact? This is a question that I've been asked on a number of occasions. Well, I mentioned to you that we have appointed research assessors. We're also in the process of appointing research users. These are people who work in hospital trusts, in businesses, in industries, and they will be involved with the academic assessors in assessing impact case studies. For every impact case study, there will be 3 assessors, 2 academics and 1 research user. The academic's role is to look at the underpinning research for the impact to see if it's at least 2-star or above. And it's a 2-stage process. If we look at the underpinning research and we say, no, it's not 2-star, it's not of good quality equating to internationally recognized research, then we don't even look at the case study. It gets an unclassified score. If we say, yes, it does equate to 2-star, then the 2 academics and the research user will assess the impact. So that 2-stage that 2-stage process is very important. So you have to ensure that the research is 2-star. And again, I will come back to that. A lot of people speak about the time lag, the lag between undertaking the research and having impact. For REF 2014, that was 20 years. For REF 2021, it's just over 20 years. It's from the 1st of January 2000 to the 31st of December 2020. So within that 20-year time frame, the research can be undertaken that will show the impact. Some sub-panels are not very happy with that. They say that's not long enough. The physics panel would like another 10 years put onto that. So this time lag is really important. And you can see from this slide that there are some examples of the time lag that exists between research and impact. There are many others. Einstein's theory of relativity was developed in 1916, but it was not until 1973, when the GPS technology was invented, that it became truly valuable. Also, in the 1960s, scientists invented lasers based on some of Einstein's work 40 years beforehand. But in the 1960s, when they invented lasers, they didn't see that the impact it would have on eye surgery 60 years later, or indeed on DVD technology 60 years later. So this time lag issue is one that's very important. And people complain is, if you undertake blue skies research, we don't know if you undertake blue skies research what the impact will be. How can you have a pathway to impact with that type of research? So there's quite a bit of criticism at the moment around that time lag between undertaking research and showing impact. And I think you'll agree with me that the longer that time lag, the more difficult it is to have the link between the research and the impact. Continued case studies. This leads on from research lag, because we, as I mentioned previously, had 7,000, just under 7,000 impact case studies submitted to REF in 2014. Goodness knows how many of those we're going to see again in 2021. I would suspect quite a number. And this is exercising a lot of people. And there's been a consultation on REF just closed last month, and a lot of that consultation was about what is a continued case study. So if I give you an example of climbing Mount Everest, getting to base camp is impact, and then getting to the summit is also impact. So perhaps in 2014 you got to base camp, and in 2021 you'll be submitting a case study showing that in the same topic area, with no further research, you have reached the summit. And that's what we're expecting to see. Main Panel A has been criticised quite considerably compared to the other 3 main panels, being more strict about continued case study. They said they expect to see new impact case studies because that will show the vitality of the discipline. The other three main panels don't say that. They will treat impact case studies and continued case studies the same. So main panel A has come under considerable criticism for that. Okay, I want to take you through a number of slides now to show that link between research and impact. So this first one is an obvious one, that the research is carried out and impact on social, economic, cultural, quality of life, environment, whatever takes place. Here you will see that impact case studies are non-portable. So in other words, if you're in University A and you carry out that research in University A and you move to University B, University B cannot count that impact, cannot return that impact case study unless there's been further research done. It belongs to University A. In other words, it's non-portable. You will also see that impact can be undertaken by the underpinning research can be undertaken by Category A staff. These are staff employed by the university, but they may also be underpinned by research carried out by what they call Category C staff. And these are staff who are working in a local trust perhaps, but the research is focused within the university. So this slide also belies that it's not really linear. In fact, the research can take place at the exact same time as the impact. And in fact, the publications underpinning research go up to the end of December 2020, whereas the impact case studies stop at the end of July 2020. And this shows that the publications, your outputs, describing the research to underpin the impact can actually take place after the impact itself. So there's no link. It can be diverse, it can be indirect, non-linear. Here you can see 3 different units of assessment in the same university, the same higher education institution, and those 3 units have worked together on the research, and they can all claim the impact case study. We didn't see much of this, but each of those units could return the impact case study to the REF exercise. Here is a similar example, which I think speaks for itself, in that same university, 2 different units. The research carried out in one unit is picked up by another unit. Both of those units can claim the impact in the REF process. And here is a member of staff who's moved from University A to University B, but they've continued the research that they had carried out in University A. They've continued that focus of research in University B, and both those universities can claim the impact in the REF. Public engagement, getting back to the example I used earlier on about this particular keynote lecture, it may be that I have enormous reach. I get everybody who attended the research conference, RCN, September 2019. So as far as that reach is excellent. But significance, what has changed? If nothing has changed, if your understanding, if your knowledge, if your attitudes have not changed as a result of that, then I wouldn't score very high in significance. So that's why a lot of universities don't return impact case studies for public engagement. They're very risk averse. I would like to see more of them. Policy change. This is also very important, but a lot of the policy documents that you and I read, you will notice that they don't often cite the research that has been underpinning that policy change. So if you've been involved in carrying out research that's influenced policy, you need to get the politicians or the civil servants to give you testimonials to say, only for your research we wouldn't have implemented that new policy. I'm in a difficult situation in Northern Ireland because we haven't had a government for 3 years. So how can we undertake research that impacts policy if those people don't sit? So I'm not sure how that's going to work. Whether we'll get special treatment by REF, somehow I doubt it. Okay, the next slide is really covering everything I've said in the last few slides, that link between research and impact. You have to ensure that that link is not broken. In other words, if you don't show the underpinning research for your impact, you're not going to do very well in REF. The counterfactual is really important. If you took away that research, would the ref have happened? If you took away that research, would the impact have happened? If the answer to that is no, then it's clear that you have a very good impact case study. So how do you ensure that your research is impactful? I suppose I'll give you the example of my work. I mentioned I've been coming to this conference for 33 years. The early research that I was involved in, okay, I got a grant, I did the research, I presented at conferences like this, I published papers, and then I moved on to another, hopefully, grant or another research topic. Impact never crossed my mind. That was a very passive approach. If somebody, some trust manager on a white horse came up and took my research and implemented it on a clinical setting, that's fine, but I had no activity involved in that. We're becoming more active, which is a good thing. So we carry out research, we produce our findings, our presentations and our publications, and then we approach clinicians or we approach managers and we encourage them to implement our research. That is more active and has to be welcomed. But we need to go increasingly in a more proactive approach. We need to involve from the very start those people in our research teams who are going to help us have impact. So in the past we had a statistician in our team, we had a health economist on our team. Now we have PPI patients representatives on our team, but we also need to have people on our team who's going to work with us from design right through to dissemination, right through to development to ensure that our research has impact. If we don't do that, we're not going to do very well in terms of influence and our research influence society. Here's an interesting model from Phipps et al. In 2016, and you can see very clearly the pathway that they have went through from research right through to impact. Along the way, stakeholders have been involved, and the researcher has worked with the co-producers of research and co-producers of impact. And that's the way it should be. I have a red box around two of the sections that Phipps et al. Have identified. And if you look at the one relating to implementation, you will see that as far as they're concerned, implementation is coming up with new influence in policy or coming up with a new product. And impact is really the effect that that has on society, on culture, on environment, on quality of life, etc. So I'll come back to that. You can see why the REF keeps VCs awake at night. Each year, it's worth £2 billion allocated to UK universities. So between refs, 5 or 6 years between every ref, that's £10 billion to £12 billion a year going to universities in the UK. The results of ref also influence the international league tables. We know that a 4-star impact case study is worth about 6 to 8 4-star papers. And you know in this room how long it takes you to get a 4-star paper accepted and published. It's been estimated by Dunleavy that a 4-star case study is worth to a particular university department the equivalent of £720,000 for over a 5-year period. So you can see very clearly why this is important to universities. This slide is from RAND Europe, and you get universities, not just in the UK, but universities in other parts of the world who want to show impact for the research is introducing these sorts of initiatives. At Ulster University, we've introduced all of these. We even have an annual black tie event for impact, where we invite all our external stakeholders to a lovely dinner, and we have impact prizes. So universities' behaviours have changed simply because of impact. Now, I mentioned that there are 7,000 impact case studies returned in REF 2014. I went into that database and I typed in the word nursing, and I came up with 248 case studies, and I analysed each of those, and I'm just going to show you a few slides. This first slide is the focus on impact. Does it affect society? Does it affect the economy? Does it affect health? Does it affect culture? You can see very clearly that of the 248 impact case studies pertaining to nursing, you can see that health comes out on top. There's no surprises there. I was a little bit disappointed that the economy only come out in 2 impact case studies. Considering the great work that nurses do in getting people back to work and public health, etc., that surprised me, disappointed me a little bit. And the same applies to culture. I think nursing obviously has an impact on culture, but we didn't see in 2014 too many of those. When I looked at health in greater detail, I wanted to see what aspect of health did these 248 case studies affect. Very clearly, you can see here, change policy, guiding practice, and guidelines, the top 3. But if you go back to Phipps' model, they would say that's not an impact at all. How do you know if the policy changed anything? So you can undertake research to change policy, but did that policy have any effect on society, on culture, on healthcare? The same about guidelines. Your research has impacted in that you've developed clinical guidelines, but have those clinical guidelines resulted in less mortality, less morbidity? So those are very important questions for our discipline. I wanted to find out the type of designs that were used within these 248 nursing impact case studies. It surprised me that several of them didn't say they used any design. Now, if you have to say what your underpinning research is, and you don't say what the design you used, I think you're not going to get very far in the outset. 10 of them were mixed methods. The majority of designs underpinning impact were quantitative, closely followed by qualitative studies, but mostly quantitative, and this is a result that's been identified by other people. I wanted to find out what the funding sources were. By far, there were none. 51 of those 240 had no funding. So that tells me that there's research going on. It could be PhD research, it could be postdoc research, I don't know, but there's research being undertaken that's been submitted in REF that's having impact that was not funded. You can see that NIHR obviously comes out at the top, and ESRC, MRC, and DOH, Department of Health. Interestingly, the very bottom, and I hope Anne-Marie's looking at this, the very bottom, RCN, only one impact case study returned in REF 2014 was funded by the RCN. Hopefully there's a lesson there. People ask me increasingly, what does a 4-star case study look like? Well, there's 10 of them. And you can have this in a slide, you can click on them, and you can read all 4 pages of every one of them. So each of those were given 4-star rating in the 2014 Research Excellence Framework in Unit of Assessment 3. So, coming to the end, I would say, in conclusion, it's always good to use those 2 words whenever you're halfway through your speech. It gives your audience hope. But in conclusion, I think you would agree that impact is important for our discipline because it shows the change, the benefit that our research brings to patients, to patient care, to nursing. It also has the support of the Treasury and politicians because it proves that the taxpayers' money, the £2 billion per year that I referred to, is having an impact not only in the UK but in every country in the world. And this is an indicator that UK science is good. And when we're coming to a post-Brexit, I knew I was going to be the first person to mention the B word. When we're coming to a post-Brexit situation, the UK has to show that it is great science, and impact will ensure that that happens. Very soon there will be no reasons left why nurses and nurse researchers don't embrace research impact. There will be only excuses. Thank you very much. Thank you.
To take a couple of questions. Thank you so much. Hugh, that's very practical, but also very insightful, I think, about the situation in which many of us find ourselves facing the next REF. So we have a few minutes, and we have, I believe, some roving mics, and it would be good to take the opportunity, if you would like to put some questions to the chair of our ref panel, how often can we do that? So would anybody like to ask Hugh a question either about process or some of the issues? I can see someone's hand at the back there.
Hi. Is it working? Yes, thank you. Hi, my name's Louise Bramley. I'm from Nottingham University Hospitals. Thank you very much. That was awesome. Those PhD, possibly master's research impact case studies that weren't funded, is there any plan to do any analysis on the types of research that they were to try and influence funding later down the line?
There's been a lot of analysis done, and people are still, Tricia Greenhalgh, for example, has already published in this field in social science using really strong methodology, and I know that there are other nurse researchers across the UK, it's not published yet, that are looking in great detail because the data is there. It's a rich mine of data. I have some slides that I haven't shared today because of time, and I'd be very happy to have a conversation with you later in terms of some of the data I found out about PhD students. But in essence, PhD students are not returned in REF, as you know, because they're not seen as independent researchers. They're carrying research supervised by other people, but their research has found its way into impact case studies. But we don't know to what extent, and I'm looking forward to seeing that research being published. But I know some of the people who are undertaking that research, and I can give you some contact details, but I don't know what the results of that are yet.
Mary?
Thanks, Hugh. Mary Wells from Imperial. That was a great talk. I've always thought it was an interesting decision of the REF panels that impact doesn't go with the person. And I do understand some of that, but I do think, perhaps particularly in nursing, that impact of a research project or projects that was done in one university some years ago might well be forgotten because of the fact that years ago we didn't really know about how to record impact and how to think about it. And impact may have happened, but it kind of might get lost because it doesn't go with that person who really knew. And I just wonder whether that's something that is considered. Well,
you're probably aware, and thank you for the question, you're probably aware that the last time out, 2014, publications were portable. You could take them with you. This caused a great deal of upset in those universities that supported staff to get those publications. So that has changed. We're in an interim phase now where both universities can count the publications, the outputs, the university you left and the university you went to. So there's hope yet for impact, but not for 2020. They're very clear for 2021, shall I say, that impact is non-portable. It belongs to the university where the research was carried out. That may change in the future, but not for 2021. And I know for a fact that we give unclassified, and you don't want to get unclassified for a case study. We give unclassified the last time out to some people who tried to claim that they moved university and took their impact with them, and it just didn't work. So I'm afraid, I suppose the message I would leave here today with is that this is a game, and the game has rules. And if you're going to play the game, you need to know the rules. And if you don't play the rules, you're not going to do very well in the game. And unfortunately, one of the rules is it's non-portable at the moment. Sorry, your mic's off.
Interestingly, I think it makes more sense to take your impact than to take your publications. But anyway, that's a discussion for later, perhaps. Thank you.
There's one more at the front here.
Prof, there's no doubt that you are an accomplished scholar and a great researcher. We are from Nigeria, one of the universities in Nigeria, precisely University of Jos. We are about developing our postgraduate programs, commencing from next session. Is there a way we can develop some partnership with your university towards assisting us in socializing and creating this kind of impact studies? Because what we find that in our community is that most of the studies are just about knowledge, attitude, and behavior, which I believe that you people have moved past. So I'm afraid, I don't know whether you could be of assistance towards that idea, sir. Thank you.
Thank you. I think, and if you're at this conference, you will meet many people who'd be very keen to collaborate with you. We've, as I said, for 33 years in the UK, we've lived with some sort of a system to assess and review the research that we carried out, and we're in the latest iteration of that with REF. I think other countries, and they're increasing, I think the last country who are now doing the equivalent of REE, Research Assessment Exercise, is Romania. I don't know of any African countries that have yet carried out that exercise, but I know that increasingly governments have to make decisions. Where do we put taxpayers' money? What universities do we give it to, and what amount should we give to fund research? And I think that I would say that a lot of countries will start getting interested in what we're doing in the UK. And as I said, I'm sure there'll be lots of people who'd be willing to collaborate with you to share what we have learned in the last 33 years.
Thank you very much, Hugh. I think we've learned both practically and from an intellectual perspective there, knowledge for that. So I'm aware that the time is against us as always, and it's time for refreshments. But before we do, I just want to thank our panel for welcoming us to this city of Sheffield and this year's conference, but especially to our keynote speaker, Professor Hugh McKenna, who shared his experience and his insights into that great beast that's known as REF 2021. So thank you all very much. See you in the concurrent sessions.